Depression is not just a personal struggle. It is a global issue that affects communities and societies at large. The impact of depression is felt in every corner of the world, from bustling cities to quiet rural areas. Depression is a serious problem. It is a condition that goes beyond mere sadness, affecting one's ability to function in daily life. The emotional pain can be overwhelming, leading to a sense of hopelessness and despair. It affects millions of people. Every year, countless individuals find themselves battling this invisible enemy. The numbers are staggering and the personal stories are heart-wrenching. It is a leading cause of disability worldwide. The economic and social costs are immense, affecting productivity and quality of life. Yet the true cost is measured in human suffering. Many people suffer in silence. The stigma surrounding mental health issues often prevents individuals from seeking the help they need. They feel isolated and misunderstood. They are afraid to ask for help. Fear of judgment and discrimination keeps them from reaching out. This fear can be paralyzing, making it difficult to take the first step towards recovery. This can make it difficult to treat. Without proper support and treatment, depression can worsen, leading to more severe consequences. Early intervention is crucial. Depression affects people of all ages. From teenagers to the elderly, no one is immune. It can strike at any stage of life, disrupting education, careers, and relationships. It can affect anyone, anywhere. Regardless of background, culture, or socioeconomic status, depression does not discriminate. It is a universal challenge that requires a collective response. It is important to talk about depression. Open conversations can break down barriers and reduce stigma. By sharing our experiences, we can create a more supportive environment. We need to raise awareness. Public education campaigns and community initiatives can help inform people about the signs and symptoms of depression. Knowledge is power. We need to support those who are struggling. Offering a listening ear, showing empathy, and encouraging professional help can make a significant difference in someone's life. We can fight this together. Community support and solidarity are essential in combating depression. Together, we can create a network of care and understanding. We can help people get the treatment they need. Access to mental health services and ongoing support can lead to recovery and a better quality of life. Let's work together to make a difference. Everyone feels sad sometimes. It's normal, it's part of life. Sadness can be triggered by various events like losing a loved one, facing a setback, or even watching a touching movie. These feelings are usually temporary and fade with time. Sadness is a natural human emotion. It's a response to situations that are difficult or painful. It's a way our mind processes and copes with challenges. It usually passes with time. You might feel better after talking to a friend, engaging in a hobby, or simply allowing yourself to cry. However, clinical depression is different. It's not just feeling down. It's a medical condition. Depression is more than just a temporary feeling of sadness. It's a persistent state that affects your overall well-being. It affects your thoughts, feelings, and behavior. Depression is persistent. It can make it hard to find joy in activities you once loved, and it can make everyday tasks feel overwhelming. It lasts for at least 2 weeks. This prolonged period of low mood and disinterest is a key indicator of depression. It interferes with daily life. Depression can make it difficult to get out of bed, maintain relationships, or even perform basic self-care. It makes it hard to work, study, or enjoy life. The things that once brought you happiness may no longer have the same effect. If you are feeling down for a long time, seek help. It's important to recognize when sadness has turned into something more serious. Talk to a doctor or therapist. They can provide a diagnosis and recommend treatment options that can help you manage your symptoms. They can help you get the treatment you need. Remember, seeking help is a sign of strength, not weakness. You don't have to go through this alone. Depression can manifest in many ways. It affects people differently. However, some common symptoms exist. One symptom is a persistent low mood. This means feeling sad, hopeless, or empty most of the day, nearly every day. Another symptom is a loss of interest in activities you once enjoyed. Changes in appetite and sleep patterns are also common. Some people eat more and sleep more. Others lose their appetite and have trouble sleeping. Depression is not just in your head, it's a real medical condition. It affects your brain. Studies have shown that people with depression have physical changes in their brains. This includes smaller frontal lobes and hippocampal volumes. Depression also involves neurotransmitter imbalances. Neurotransmitters are chemicals in the brain. They carry signals between nerve cells. These imbalances can affect your mood, sleep, appetite, and energy levels. The exact cause of depression is unknown. However, many factors can contribute to it. These include genetics, environment, and life experiences. Genetics plays a role. Depression can run in families. If you have a family history of depression, you may be more likely to develop it. Your environment can also play a role. Stressful life events, such as trauma, abuse, or the death of a loved one, can trigger depression. People with mental health conditions often delay seeking help. They may feel ashamed or embarrassed. They may not realize they have a problem. On average, people wait over 10 years to seek help for mental health conditions. This delay can have serious consequences. It can make treatment more difficult. It is important to remember that depression is treatable. Seeking help is a sign of strength, not weakness. The earlier you get help, the better. Many effective treatments for depression are available. These treatments can help you regain control over your life and improve your overall well-being. It's important to remember that what works for one person may not work for another, so finding the right treatment can be a personal journey. The best treatment for you will depend on your individual needs. Factors such as the severity of your depression, your personal preferences, and any other health conditions you may have will all play a role in determining the most effective approach. One common treatment is medication. Antidepressants are often prescribed to help manage the symptoms of depression. These medications can help to correct chemical imbalances in the brain that may be contributing to your depression. Antidepressants can help to correct chemical imbalances in the brain. It's important to work closely with your doctor to find the right medication and dosage for you, as it may take some time to see the full benefits. Therapy is another effective treatment option. There are various types of therapy available, including cognitive behavioral therapy, CBT, which focuses on changing negative thought patterns, and interpersonal therapy, IPT, which addresses issues in personal relationships. Therapy can help you to understand and manage your thoughts, feelings, and behaviors. It provides a safe space to explore your emotions and develop coping strategies. Many people find that therapy helps them gain new perspectives and build resilience. In some cases, a combination of medication and therapy may be recommended. This integrated approach can address both the biological and psychological aspects of depression, offering a more comprehensive path to recovery. It is important to work with a qualified mental health professional. They can help you to develop a treatment plan that is right for you. Regular follow-ups and adjustments to your treatment plan may be necessary to ensure the best outcomes. They can help you to develop a treatment plan that is right for you. Remember, recovery is possible. With patience, persistence, and the right support, you can find a path to healing. With the right treatment and support, you can overcome depression and live a full and meaningful life. Don't hesitate to reach out for help and take the first step towards recovery today.